Affective disorders, mechanisms, treatments, and genetics. 1. Definition and description of affective disorders. Affective disorders are defined as affect, as a noun, refers to feelings or emotions. While the primary symptom of schizophrenia is disordered thoughts, the affective disorders, also called mood disorders, are characterized by disordered feelings. These disorders encompass a range of conditions, primarily major depressive disorder, MDD, and bipolar disorder. 1.1. Major depressive disorder, MDD. MDD is characterized by persistent feelings of sadness, despair, and little energy, and more talked down, sometimes becoming almost torpid. Individuals may experience periods of unusually and have strong feelings of guilt. Key symptoms include depressed mood. People experiencing depression may cry a lot. They may be unable to experience pleasure and lose their appetite for food and sex. Their sleep may be disturbed. Anhedonia, inability to experience pleasure. Sleep disturbances. People with depression often have difficulty falling asleep and awaken early and find it difficult to get to sleep again. People with depression often become constipated and secretion of saliva decreases. Suicidal ideation. The second type of affective disorder is major depressive disorder, MDD, characterized by depression within a mania. This depression may be continuous and unremitting or, more typically, may come in episodes. Suicide risk is significantly elevated, with 15.9% of people with MDD and 21.1% of people with bipolar disorder attempting suicide. Rates of completed suicides among those with affective disorders are 28.8 times higher than expected for people of the same age in the general population. 1.2. Bipolar disorder. Bipolar disorder is characterized by alternating periods of mood and depression, a condition called bipolar disorder. The manic episodes involve symptoms of exaggerated euphoria, increased self-esteem, and grandiosity. Mania is defined as a matter of degree. It is difficult to tell exasperated and a zest for life pathological, but people with mania usually exhibit nonstop speech and motor activity and grandiosity. During manic episodes, individuals may experience rapid flight of ideas, but lack the severe thought disorganization that is seen in schizophrenia. Sleep is often undisturbed or reduced, and individuals may feel as if they are unstoppable, frequently working on projects that are often unrealistic or engaging in other extremely goal-directed behaviors. 2. Genetic factors. Evidence strongly suggests a genetic component to affective disorders. Evidence indicates that a tendency to develop an affective disorder is a heritable characteristic. Heritability. Studies show a heritable characteristic. Twin studies. Concordance rates for affective disorders are 10 times more likely to develop these disorders than are people without developed relatives. 4. Monozygotic twins, identical. The concordance rate for an affective disorder is 69% compared to 13% for dizygotic twins fraternal. Genetic markers. Research indicates a biological basis, with genetic studies having found evidence that genes on several chromosomes may be involved in affective disorders. 3. Biological treatments for affective disorders. A range of biological treatments are employed, targeting various neurochemical and physiological processes. 3.1. Antidepressants. These medications primarily work by increasing the synaptic availability of monoamines, norepinephrine, serotonin, and dopamine. Monoamine oxidase, MAO inhibitors. MAO inhibitors, drugs that inhibit the reuptake of norepinephrine or serotonin or interfere with NMDA receptors. Electroconvulsive therapy, transcranial magnetic stimulation, deep brain stimulation, vagus nerve stimulation, bright light therapy, phototherapy, and sleep deprivation. Selective serotonin reuptake inhibitors, SSRIs, which are also what their name indicates, include fluipramine, Prozac, citalopram, Celexa, and paroxetine, Paxil, are widely prescribed for antidepressant properties and for their ability to reduce the symptoms of obsessive-compulsive disorder and social phobia. Serotonin-norepinephrine reuptake inhibitors, SNRIs, which also do what their name indicates, include milnacipran, duloxetine, and venlafaxine, with effects on 5-HT and norepinephrine transporters. Tricyclic antidepressants. These are short-term effects of all antidepressant drugs are to increase the amount of monoamine neurotransmitter present in the synapse to bind to the postsynaptic and presynaptic receptors. 3.2. Ketamine and brexanolone. These drugs offer faster-acting antidepressant effects. Ketamine. Anti-holding antidepressant drugs currently in use act as noradrenergic or serotonergic agonists by inhibiting the reuptake of these neurotransmitters. Evidence shows that an NMDA antagonist ketamine may alleviate the symptoms of treatment-resistant depression. It produces rapid and robust antidepressant effects. Brexanolone. A new antidepressant drug, brexanolone, may hold promise for treating symptoms of postpartum depression among women following birth of a child. It is an allosteric modulator of the GABA receptor. 3.3. Lithium, primarily used for bipolar disorder. The therapeutic effect of lithium, the drug used to treat bipolar affective disorders, also occurs very rapidly. This drug, which is administered in the form of lithium carbonate, is most effective in treating the manic phase of bipolar affective disorders. Once the mania is eliminated, depression usually does not follow. Lithium has side effects and can lead to nephrotoxicity, hypothyroidism, and tremors. It also increases neuroprotective proteins that promote cell growth. 3.4. Electroconvulsive therapy, ECT, another biological treatment for depression, has a long history. ECT is used for severe, treatment-resistant depression. It involves applying an electric shock to the head for a few seconds to produce seizures. The effects of ECT are more rapid and produce more substantial remission of symptoms than antidepressant drugs. 3.5. Vagus nerve stimulation, VNS. Vagus nerve stimulation is an invasive electrical stimulation of the vagus nerve that is another intervention that we have for people to minimize the symptoms of depression. It involves implanting a device under the skin to stimulate the vagus nerve. 3.6. Transcranial magnetic stimulation, TMS. Transcranial magnetic stimulation, TMS, is a non-invasive procedure where a rapidly changing magnetic field induces electric currents in the brain, stimulating neurons. It is used for treatment-resistant depression. 3.7. Deep brain stimulation, DBS. Deep brain stimulation, DBS, is an invasive surgical procedure that involves implanting electrodes in specific brain regions. DBS of the subgenual anterior cingulate cortex, subgenual ACC, has shown promise for treatment-resistant depression. 4. Neurobiology of affective disorders. 4.1. The role of the frontal cortex. Neuroimaging studies reveal altered activity in specific frontal cortex regions. A consistent finding in neuroimaging studies of depressed patients is hyperactivity of subgenual ACC along with decreased activity in other regions of the prefrontal cortex, including the dorsolateral PFC, the ventromedial PFC, and the orbitofrontal cortex. Successful antidepressant treatments, DBS, TMS, VNS, SSRI, SNRI, have been shown to normalize the activity of these regions, with decreased activity of the subgenual ACC and usually increase the activity of other regions of the frontal cortex. 4.2. The monoamine hypothesis. This hypothesis suggests that depression is caused by insufficient activity of monoaminergic neurons, norepinephrine, serotonin, and dopamine. The therapeutic effect of noradrenergic and serotonergic agonists and the depressant effect of reserpine, a monoaminergic antagonist, suggested the monoamine hypothesis of depression, that depression is caused by insufficient activity of monoaminergic neurons. Depletion of tryptophan, a precursor to serotonin, can cause a recurrence of depressive symptoms in depressed patients who are in remission. However, SSRIs have an immediate effect on serotonergic transmission in the brain. They do not relieve the symptoms of depression for several weeks, posing a challenge to the monoamine hypothesis. 4.3. Role of neurogenesis. Stress and depression are associated with reduced hippocampal neurogenesis. Antidepressant treatment increases hippocampal neurogenesis. There is currently no way to directly measure the rate of neurogenesis in the human brain. So far, all the evidence that antidepressant treatment has motivated researchers to try to develop ways to alleviate the symptoms of patients who continue to suffer. 5. Role of circadian rhythms. Circadian rhythms, or daily cycles of physiological processes, play a significant role in affective disorders. Sleep disturbances. Sleep disturbances are characteristic of affective disorders. In fact, total sleep deprivation rapidly, but temporarily, reduces depression in many people, and selective deprivation of REM sleep does so slowly, but more lastingly. Total sleep deprivation, TSD, in addition, almost all effective antidepressant treatments to remove REM sleep alleviates depression. TSD produces an immediate but transient antidepressant effect. However, the brain produces a chemical that has a depressogenic effect in susceptible people. REM sleep deprivation, REMD. One effective antidepressant treatment is sleep deprivation, either total selective REM sleep deprivation. It produces an immediate improvement in mood. Seasonal affective disorder, SAD. Another phenomenon relates depression to sleep and waking, or more specifically, to the mechanisms for circadian rhythms. SAD is a form of depression that is seen in the winter months, when the days are short and nights are long. Light therapy. Phototherapy is a safe and effective treatment for SAD, especially in the mornings. Daily exposure to light can produce a phase advance in their cycles. Bottom of form. Glossary of key terms. Affective disorders, a group of mental illnesses characterized by significant disturbances in mood, emotion, and feelings, including major depressive disorder and bipolar disorder. Major depressive disorder, MDD, a mood disorder characterized by prolonged periods of sadness, anhedonia, loss of pleasure, feelings of worthlessness, sleep disturbances, and other symptoms that interfere with daily life. Bipolar disorder, a mood disorder characterized by alternating episodes of mania or hypomania and depression. Mania, a state of abnormally elevated, expansive, or irritable mood, often accompanied by increased energy, decreased need for sleep, grandiosity, and impulsive behavior. Hypomania, a less severe form of mania, characterized by similar symptoms, but to a lesser degree and without significant functional impairment or psychotic features. Monoamine hypothesis, a theory suggesting that depression is caused by insufficient activity of monoamine neurotransmitters, norepinephrine, serotonin, and dopamine, in the brain. Selective serotonin reuptake inhibitors. SSRI is a class of antidepressant drugs that selectively block the reuptake of serotonin, thereby increasing its concentration in the synaptic cleft. Monoamine oxidase inhibitors. MAOI is an older class of antidepressant drugs that inhibit the enzyme monoamine oxidase, which breaks down monoamines, leading to increased levels of norepinephrine, serotonin, and dopamine. Tricyclic antidepressants. TCAs, an older class of antidepressants that block the reuptake of both norepinephrine and serotonin. Ketamine, an anesthetic that, at subanesthetic doses, acts as an NMDA receptor antagonist and has been shown to produce rapid antidepressant effects. Electroconvulsive therapy, ECT, a medical procedure involving the induction of a brief seizure through electrical stimulation of the brain, used as a treatment for severe depression and other psychiatric conditions. Vagus nerve stimulation, VNS, a non-pharmacological treatment for depression that involves implanting a device to deliver electrical impulses to the vagus nerve. Transcranial magnetic stimulation, TMS, a non-invasive brain stimulation technique that uses magnetic fields to induce electrical currents in specific brain regions, used to treat depression. Deep brain stimulation, DBS, a neurosurgical procedure involving the implantation of electrodes in specific brain regions, e.g., subgenual ACC, to deliver electrical impulses, used for treatment-resistant depression. Subgenual anterior cingulate cortex. Subgenual ACC, a region of the prefrontal cortex implicated in mood regulation and emotional processing, often shows increased activity in depression. Neurogenesis, the process by which new neurons are generated from neural stem cells, often studied in the context of the hippocampus and its role in mood disorders. 5-HT transporter gene, SLC6A4, a gene that code for the serotonin transporter protein. Variations in this gene have been linked to susceptibility to depression and antidepressant response. Circadian rhythms, biological processes that display an endogenous oscillation of about 24 hours, e.g., sleep-wake cycle, which are often disrupted in affective disorders. Total sleep deprivation, TSD, the complete absence of sleep for an extended period, which can temporarily alleviate depressive symptoms in some individuals. Slow-wave sleep, SWS, deprivation, the selective reduction or absence of slow-wave sleep, a stage of deep sleep, which has been shown to have antidepressant effects. Seasonal affective disorder, SAD, a type of depression characterized by a recurrent seasonal pattern, typically occurring during fall or winter months. Light therapy, a treatment for SAD involving exposure to bright artificial light, which helps to reset circadian rhythms and alleviate depressive symptoms. Monoamine oxidase, a MAO, an enzyme that breaks down monoamine neurotransmitters, serotonin, norepinephrine, dopamine. Tryptophan depletion, a research method used to temporarily lower serotonin levels in the brain by restricting dietary tryptophan, a serotonin precursor, which can induce depressive symptoms in susceptible individuals.